Okay, let's talk about the essential electrical system here. And this is a part that we could spend a lot of time on. It's really one of my favorite parts of Article 517 and where we really get to talk about how 517 is laid out. This is part 3 now of Article 517. A couple of the changes that we see coming down the pike or have come down the pike is the introduction of the EES, an acronym. So type 1 and type 2 essential electrical systems. NFPA 99 has used the terms type 1 and type 2 essential systems for quite some time. So what we're going to find is type 1 and type 2 systems are generally used. Type 1 is going to be in our category 1 spaces, and type 2 generally are category 2 spaces, which are our general care locations versus critical care, most likely a nursing home or a limited care facility that doesn't provide any type of critical care space. But we'll see how this moves as we go along. It has to be comprised of separate branches, and the whole goal here is to supply a limited amount of lighting and power service, which is considered essential for life safety and an orderly cessation of process during the time that the normal electrical service is interrupted. It's about supplying enough power and lighting for life safety and essentially bringing any processes to any process or operations or medical treatments that might be going on at the time we have a loss of power to a safe cessation or to a safe end or a safe stopping point. So that's really the main goal of these types of systems. Also within 517.26, where we talk about the general requirements for essential systems, Article 517 it actually throws out these sections of Article 700, which would be a longer discussion for another day, with some of the capacity requirements, some of the separation requirements, and so forth. So again, just to point out that 517.26 says it amends Article 700 by dropping these sections, if you will. So type 1 essential systems, and again, that's when you see the 2020 flag. So these are generally what we would have applied to hospitals in the past in the older language. So 517.29 through 517.35, these are the requirements that we would apply to type 1 systems. They're required for category 1 spaces. They're also permitted to serve these other spaces. Okay, category 1 spaces cannot be served by a type 2 general category 2 care system. So required for this. This has always been the requirement, but just broken down into categories in type 1 and type 2. So as you can see, a type 1 system is going to provide me with 3 branches. It's going to give me my life safety branch, my critical branch, and my equipment branches. Okay, and again, we get into a much more lengthy discussion about these during the full day program. And then a type 2 system, as you'll see, doesn't really give me the critical care level. It gives me my life safety branch, which is going to generally be dealing with patient egress pathways and things like that. When you're in a type 1 system, now you got the critical care spaces, the number of receptacles, all these kind of things, and the supply to those types of receptacles. But in a type 2 system, really it's given me my equipment that allows me to safely maintain this facility operation under a power outage, and my egress pathways should I need those during the time that general power is compromised.